So coming to the pelvic floor muscle dysfunctions. So our role is very, very crucial in the pelvic floor dysfunctions. So if we see the pelvic floor muscles, so because of the fetus weight and also because of the anti-gravity of these muscles, so it may stretch these pelvic floor muscles. So if you see the pelvic floor muscles, so these muscles are going to be in the 3 layers, superficial layers, and also the diaphragm and the urogenital diaphragms, and also pelvic diaphragm. If you see the superficial muscles are, so ischio-cavernous, bulbo-cavernous, and also superficial transverse perineal, external anal sphincters. So if you see here, so these are the ischio-cavernous and also bulbo-cavernous. So here, these muscles are going to be, is going to be the vaginal muscles. So these, So these pelvic floor muscles, because of the anti-gravity and also during the vaginal delivery, these muscles may become overstretched and may chance to get the weakness. So if you understand about where is the location of these pelvic floor muscles, so we can give the strengthening training if they're having complication related to the pelvic floor dysfunctions. Just here I'm showing where the pelvic floor muscles is simply understanding the muscles surrounding to the vagina and also muscles surrounding to the anus. So these muscles are very important. So after during the pregnancy as well as after the pregnancy, because overstretching of these muscles may lead to urinary incontinence or maybe fecal incontinence. If the muscles are not functioning properly, so it may produce the incontinence. Incontinence means leakage. They may chance to get the urine leakage and may chance to get the fecal material leakage. So that depends upon the severity of the muscle weakness. So how we know the severity of the muscle weakness? So we have to check how much of time they are going to hold the urine. So if anybody having any urinary incontinence, so we can give some water, ask them to get the bladder fullness. Then we can ask them to hold how much time they are going to hold the urine. So if it is severe weakness, so immediately they may chance to get the urgency, or they may chance to get the dress wet or the cloth wet. So these symptoms we can observe. So we can identify the severity of the weakness and we can train before the pregnancy, before the delivery, and also as well as after the delivery. So who are going to get the more muscle weakness in the pelvic floors? So the risk factors, especially the childbirth. Childbirth is obviously most significant risk factor for the pelvic floor impairment. So especially the labor process, during the labor process, or if get any trauma during the labor or during the delivery period. So that means during the second stage of the labor. So if you see the stages of the labor, in the second stage of the labor, so the mother has to put more effort and also has to push the baby out. In those times, so the mother has to put more pressure on the pelvic floor muscles. So it may lead to a trauma to the pelvic floors. So it may damage to the pelvic floor muscles. Sometimes if any mother having the difficulty in the delivery, so because of the baby, the big head, or the birth canal is small size, sometimes the mother cannot push the baby out. So the pregnancy time is going to be longer duration. The labor will be the longer durations. So because of the longer durations, the surrounding muscles, the vaginal muscles, the pelvic floor muscles are going to overstretch and may damage. It may lead to the tears of the perineal muscles. So it leads to the muscle weakness. And also other causes are who are getting the multiple pregnancies. And also multiple pregnancies, some women may chance to get the twins, triplets, and quadrets. That means 3 babies, 4 babies, sometimes. So because of the weight of the fetus, the muscles are going to be overstretched. So it may lead to the weakness, and also it may produce the muscle weakness and also incontinence. Other than these factors, and also other risk factors are who are taking smoking, who are smoking, or who are having alcohol, the high intake of the alcohol, or if anybody having severe constipation, that is a chronic constipation, or any cough during the pregnancy. if any respiratory infections. So during the respiratory, during the pregnancy, if anybody gets respiratory infections while coughing, so the more pressure will be in the pelvic floor muscles and also abdominal muscles. So may chance to get the more weakness. And also obesity and hysterectomy. So these risk factors may produce the pelvic floor dysfunction. And also another causative factor is a high caffeine intake. So high caffeine. So it's at least 3 to 4 cups of the coffee is the is it recommended for the mother? But if it is crossed more than like a 4 to 8 cups, so it may increasing the caffeine percentage. So may chance to get the other complications related to the caffeine. So better we can ask them to try to avoid the more than 3 cups of the coffee during the pregnancy and also after pregnancy. And also, what are the effects during the pregnancy? So it's the effects especially of the childbirth and the pelvic floor. So majorly the neurological compromise, so such as the pudendal nerves. So mainly the pudendal nerve is going to be overstretched. So this pudendal nerve mainly supplies to the surrounding the muscles. So these pudendal nerve may chance to get the overstretch. So because of the overstretch of the pudendal nerve, so it may give the discomfort and also pain, tingling, numbness sensation in the perineal and also pelvic region. So muscular impairment. So extreme stretching of the pelvic floor tissue is inherent in the process of labor and also vaginal delivery. So who are going to the vaginal delivery, there is nothing but normal delivery. So because of the small size of the vagina or the birth canal or big size, if the fetus head is become bigger size, so very difficult to push the baby outside. So during this process, so it may chance to get the overstretching of these pelvic floor muscles. So it may chance to damage or it may chance to get the more weakness. So during the delivery, if the mother is not able to push the baby properly, so the physicians or doctors are going to do the small incision at the vagina, so towards the anus. So this process is called as the episiotomy. So depends upon the baby, depends upon the baby position. The physicians or doctors are going to do the incisions. So either medial and also is a lateral. So depends upon the incision they are going to do. So these incisions are going to be during the delivery time. So it's very important. So after the delivery, our role will be more in the episiotomy. So may chance to get the infections and also may chance to get the incontinence and also healing also may difficult if anybody having the diabetes. So in that particular time, our physio role and also nurses role are very crucial to avoid the complications surrounding to the birth canal.